Thank you, Anna, and thank you for all you and your and Hunter's Hope does for the families that are affected by leukodystrophy. Um, I must confess, I knew absolutely nothing about Hunter's Hope or leukodystrophy or Krabbe before Cloud was affected by it. Um, you asked me, or you gave me the topic of newborn screening from a family perspective, and that's a pretty easy topic to address on the surface. If you've benefited from newborn screening, you know that your child's life has been enhanced tremendously, hopefully. If you did not benefit from newborn screening, you wonder why your child or your loved one did not have that opportunity. I'm so thankful that Hunter's Hope is moving forward with the RUSP nomination. Uh, Many states, Anna, as you pointed out, give credence to what's on that panel, but Krabbe will not wait, and Krabbe moves on, and so it's important that we all continue to work in the areas that we can to try to get our individual states to get Krabbe on our newborn screening list. Um, our family, from a family perspective, our family is Cloud Sanders Kirbo, and you see him in the pictures that are coming on the screen. He's a delightful, happy child, and uh, has such an endearing smile. They're just uh, people cannot comment on him without commenting on his smile. Wonderful mother, that's Sloan, my daughter-in-law, who actually was assisted in my law practice, that is not here anymore because she's needed 100% of the time with Cloud. And she's married to my son, Carlisle, who was my middle son, and there's Carlisle. And, and Cloud is their only child. Um, So we'll tell you a little bit about our efforts in Georgia. We'll try to just cover the basics of it. There's a lot more to talk about that we won't be able to talk about today. I'll be more than happy to speak with anyone who might want to know more about our efforts. But with children, even though Cloud has his own story, with children born or diagnosed with Krabbe in a state where there's no newborn screening for Krabbe, our journeys are pretty much similar. Something's not right with our child. What is wrong? We have medical teams and healthcare providers that are perplexed. They're not familiar with this condition. We all go through an agonizing wait for our child to be diagnosed. We go on a roller coaster where we have emotions as high emotions and low emotions. We have never heard of the word Krabbe, and then we get that word thrown at us, and then we hear the pronouncement of what that will mean for our child or our grandchild or our loved one, and it is so, when I think about it, it's hard to even put in perspective what all of that brings to me as I think about the journey that we made initially with Cloud. Cloud, from all factors that we considered, we thought him to be a perfectly normal child until he approached his his third birthday, and we noticed that his gait was a bit disjointed, and he was just a little bit off balance, limping as he walked, and that was in June of 2019. We immediately, I say we, Cloud and Sloan Carlisle and Sloan were so proactive. They immediately got him to their pediatrician and then to a muscle and bone doctor, and determined that there was nothing that would have caused his limp or his condition. And so we got him immediately up to the Children's Hospital of Atlanta. and we were thankful, but when we got a diagnosis of suspected Guillain-Barré syndrome, after several days and lots of examinations with the neurologist, and we're told that to take him on home, and we believe he's progressed along with that syndrome, and that it will gradually he will be, back to normal, but back to what we thought was normal. And unfortunately, that was not the case. And within about 2 weeks, we were back up in the Children's Hospital of Atlanta, and Cloud had by that time pretty much lost his ability to walk, and was obviously in a lot of pain. And on August 9, 2019, we, Cloud, and Carlisle and Sloan and I received the diagnosis. And those of you who have been in that situation know what that sometimes means. This is what it meant for us. We were in a room that we were summoned to. We got the pronouncement. Pain and agony and hopelessness rained down upon us, and we didn't know what to do. We were told that because Cloud was symptomatic, there was nothing else that could be done for him at the Children's Hospital of Atlanta. We were told that if we desired, that we could go home, and that Cloud's life would be short, that we to love on him and take care of him the best we could, that while there had been a lot of progression with the treatment of Krabbe and other diseases, that because Cloud was symptomatic, that there was really nothing that could be done for him. And quite frankly, 2 hours later, we were on the road back to our 4-hour journey back to our home, and we were full of hopelessness. I know that I wondered on the way back how someone would know that they had Krabbe if they were not symptomatic, and didn't know anything, of course, about newborn screening, and just wondered how somebody would know to get treatment when they had not had any symptoms. As we were leaving Atlanta, we got a casual mention of a Dr. Escalar and a Dr. Kurtzberg, and maybe even were given some contact information. From our perspective, and we might not have heard it just right, there was hopelessness even in giving us those names, because Cloud was symptomatic. I knew nothing about newborn screening. I'm 63 years old. They probably had newborn screening when I was younger and when I had my children, but I certainly didn't know about it. But I learned about newborn screening in an elevator in Pittsburgh, because Cloud eventually got accepted to go up to elevator and to Pittsburgh. And I probably don't have this exactly right, but I met a lady in that elevator that was from New York, and she had 2 children with her, and one that was upstairs in clinic. And she asked me why I was there, and I said, well, I'm visiting my grandson who's upstairs, preparatory to getting a transplant. And what kind of disease does he have, I was asked, and I said Krabbe. Turned out that all 3 of her kids had been diagnosed with newborn screening in New York. All had been transplanted, and all were doing real well, and as I understood it, remained without symptoms. And I remember that moment, and anger came on me with a fury. I began to just be angry at the doctor back home, their obstetrician. Why or how did he or she miss the newborn screening diagnosis or that Cloud would have had for Krabbe? I got mad at the hospital back in our hometown for maybe not looking at the results like they should have. I was um, uh, just angry that somebody might have dropped the ball, and I promised myself as I left that elevator that I would get Carlisle and Sloan to go back to the hospital and the doctor and get the newborn screening results and find out what it said about Cloud and leukodystrophy and Krabbe. Of course, the reaction of anger, I think, was normal, but I later learned that the doctor didn't do anything, and the hospital didn't do anything that they shouldn't have done. We did not have Krabbe screening in Georgia, and when I realized that, I recognized that I could sit back, or we could sit back and do nothing. Newborn screening was not going to help Cloud, but it would help some other child yet to be born. And it would spare a mom or dad, possibly, of the pain and agony and hopelessness that was poured upon Sloan when they were told there was nothing to be done, their child would die soon, and go home and love him the best that you can. And so I decided I was going to try to do something. And I'm just stubborn enough that I thought that I could do it myself. Well, it turned out that I was way wrong about that. And we'll get to that in just a few minutes. I know that my time is limited. But I learned through doing some research that we had a child several years earlier in Georgia named Cove. Cove, like Cloud, was finally diagnosed with Krabbe. The situation was very similar to Cloud, and what Cove's parents did is they called their legislator. That's what many people will do. And the legislator promised that he would get a bill passed and introduced a very good bill. He didn't involve, as far as I know, the Georgia Department of Public Health or the Georgia Advisory Committee or anybody else. He was going to get that lost through the Georgia General Assembly. And unfortunately, what happened is that the end bill that finally got passed was that if a parent to be asked for Krabbe testing, that the Georgia testing organizations had to send them, coincidentally, the information about Hunter's Hope, so that you could write Hunter's Hope and get some type of test kit or direction as to how to get a test kit. So the effort to try to protect the children in Georgia really, through Cove's law, really amounted to nothing, in that no parent knew to ask. The practicing physicians didn't tell children, parents, that they ought to ask because they were not really familiar, I would say, with this disease. And so Cove's law did nothing but, in respect, heap guilt on parents who did not ask for their child to be tested for Krabbe, and I would venture to say probably saved nor enhanced no child's life. So I was perfectly, at that point, ready to go forward with trying to get it on the Georgia list. The chairman of the Senate Health Committee in Georgia, Senator Dean Burke, was the physician who delivered Carlisle. He was, I count him among my best friends. He was the Georgia Senate liaison person with the Georgia Department of Health. He was Secretary of the Senate, and I knew that he understood enough about it to where he would get a bill passed. And we consulted with each other, and he uh, uh, moved forward to get a bill passed, and we were hoping to get it passed during during the legislative session of the year 2020. And as we approached that session, Dean, you got your bill ready? I got my bill ready. When are you going to introduce your bill after it went in session? Because he wasn't introducing his bill. And finally, he called me and said, Bruce, I need you to nominate uh, Krabbe to be put on the Georgia list. Dean, I don't know enough about Krabbe to do that. Bruce, I need you to do that, because without the support of the Newborn Advisory Committee in Georgia, without the support of the Commissioner of Public Health in Georgia, I'm afraid that whatever I might introduce will have the same um, uh, outcome as Coach Law. It will not be passed in such a way that it will be as beneficial as what we should have for the children of Georgia. So disappointed, a little bit angry at my friend. I then began to learn a little bit about how you nominate a condition in Georgia. And earlier today, we saw a portion of the application for a nomination in RUSP, and the Georgia form is pretty similar to that. You must attach uh, much information about the science, about the treatment, about the just on and on and on. And as I looked at that, I became so discouraged, because I knew that I just did not have the ability to to do that task myself. The dean had asked me like in mid-January 2020 to get the nomination in so that it could be discussed at a meeting of the Georgia Advisory Committee in mid-February of 2020. So I had like less than a month to put together a nomination and put it in. I reached out to, I started really with a letter that the federal committee had sent to Jackie Wagner way back in February of 2010, where they informed Jackie that Krabbe had not been recommended, and gave her some of the reasons why it was not recommended. And I took that as best I could, and I just started researching the best I could. I reached out to Dr. Escalar's people. I reached out to Hunter's Hope. I asked them to send me what they could send me, and I put it together the best that I could. And actually, before I sent it, and this is important, I started trying to cultivate relations with the people in the Georgia lab where they do newborn screening, the people that were advisors to the Georgia Advisory Committee for conditions, and try to develop relationships so that they understood that we were real people with real needs, and that I knew that if I could just get in the door, even though my application was not as good as it should be, if I could just get in the door, I knew that I would have an opportunity, or we would have an opportunity to get this going. So we got together an application. I created a cover letter. Normally your cover letter to send the application is, here's my application, but I actually was able to go through and embed pictures of and movies of Cloud. I did that because I wanted to get in the door. And I took the letter to Jackie from 2010, and I tried to tell the Georgia people, not only was the committee that creates the RUSP enacted at the time, but there was good science. They had told Jackie that they would look at new evidence addressing the issues, but there had been no indication that they had done so since 2010. I asked the folks in Georgia to stand up and to give us the opportunity to present. I knew that if I could get there, we could convince them. So we showed up at that nomination date. I brought with me the Senator Burke, who spoke after I made my presentation and said, listen, I'm here to tell you that I know that this is going to cost money. And I'm telling you, you don't need to worry about money because I can get the money through the legislature. The science is good on this. We need this passed for the children of Georgia. And we sat down thinking that we had made a good presentation for the committee to vote to put it on the list without sending it to a study committee. We didn't really understand that that's never done. And so it didn't happen quite that way, but we actually had someone, I finished speaking, stand up and hand out letters to all the committee members and professor at Emory. And he really opposed it going on the list, being added to the newborn screening panel at that time. He suggested that some of the people who were on the previous screen that we saw in the last presentation maybe had a minority view about things, and the science had just not come to the point where it was time to add it to the list without further study, that we haven't worked out the fact that people don't show up to their appointments, or we haven't worked out who's going to pay for it. And you know, I was just so angry that this unexpected appearance from this professor from Emory, I felt like kind of just threw a kink in what we were trying to accomplish. The fact is, they didn't reject it. I learned that as you approach this issue, do not assume that people that are on the advisory committees in the states know a lot about your particular disease. They're going to be very knowledgeable about newborn screening in general. That's why they're on the advisory committee, but they're not going to know when you walk in there in your state all the details of Krabbe, all the advancements that have been made in Krabbe. And so you need to use that opportunity to educate them as best you can. The announcement was made on that February 20 meeting that this was going to be sent to a study committee, and the study committee should bring back a recommendation within about 6 months. And I held up my hand and asked to be on the study committee, and was really opposed to a study committee, but I'm so glad that it was, in retrospect, that it was created. And we worked really, really hard for about 6 months. We obtained literature from many sources. We investigated other states and their newborn screening. And in the very end, everybody on our work group, including the professor from Emory, voted unanimously to go back to our committee and suggest to them that Krabbe be added immediately upon proper funding with a 3-year pilot. And I was angry about the pilot. I didn't quite understand what that meant. And what it actually means is beginning hopefully in September, because all the equipment has been bought. The legislature appropriated the money to do so. every kid in Georgia born is going to be tested, and for Krabbe. And we'll do that for about 3 years. The lab said we need that to get our protocol in place to make sure that not other things that we need to do to enhance the possibility of this being as successful as we want it to be. And Bruce, every child is going to be tested. And what I believe we've done is partnered with another organization to do our second tier testing. And so that's what has happened. Once we got that recommendation, it had to go to the legislature for approval for funding after the Commissioner of Public Health endorsed it. And so we began lobbying legislators for the funding, and both the Appropriations Committee with the Senate, the Appropriations Committee with the House, and sent letters, had other people send letters to every member of all the committees, made sure that we followed up on it. And the budgets came out. The Senate had it on their budget. The House did not. That distressed us greatly. Dean Burke said, don't worry about it. The reason the House didn't put it in their version of the budget is they're going to want to say we'll add it if the Senate will let us add something to the Senate's list when we start doing our reconciliation. That's the way it worked on the last hour before the legislative session was over. The reconciliated budget came out and Krabbe was funded. And so we are on the right track in Georgia. God, I don't know whether I'm allowed to say this, but I'll say it anyhow. God showed himself strong and mighty throughout our short time of getting this accomplished. I mentioned to my daughter-in-law, Sloan, one time how strong she was, and her response was, listen, what choice did I have? And, you know, I told her, you had a choice. You could have just checked out, but, and not given Cloud the life that you and Carlisle are giving her. I tried to encourage both of them that God had to know that God had created them for this purpose, and that was to parent Cloud, and they were doing such a wonderful job. I would say to other families that might be in the same situation as Cloud and Carlisle and Sloan, that you know, the good Lord loves you more than you love each other. And we can't control the diagnosis. We can't control the outcome. We can't control the burden of the finances. We have a choice to surrender or fight. And if you find yourself in position where you can advocate for newborn screening, you need to be relentless. You need to fight. You need to understand that you're not doing it for your loved one who is suffering from it, but you're doing it so no other child will hear the words that he's symptomatic and there's nothing else we can do for him.